Welcome to the Healthy Lifestyles Podcast, located here in Northwest Phoenix, Glendale, and Peoria. My name is Dr. Nick Hunter. I am your host, and I am a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we have helped hundreds of people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. This podcast is intended to help you make better decisions about your health so you can find joy in the journey by bringing together top healthcare providers, fitness experts, and nutritionists in the area to give you knowledge and confidence needed to make good health decisions. Thank you for joining us today. What kind of physical therapy do we do? I'm going to talk today about our 5-step process to help get you on the right track. Many people will ask us, what makes you different, or what kind of physical therapy do you do? Because it's clear from the beginning of their journey with us that we're not like regular physical therapy. So I've outlined a summary of our process to help you better understand what you can achieve with us and how we help you get there. The first step is the discovery phone call. We absolutely believe the first step in your journey is your phone call with us. And it's not like regular doctor's offices that when you call in, they ask what's your name, date of birth, and insurance. One of the most frustrating aspects of medical care that we see in our industry right now is the lack of actual human connection. And the reason why so many people are thrilled or relieved to hear an actual human voice on the other end of our phone call. The sad thing is nothing feels wrong about the way those doctor's offices or dentist offices act when they ask what's your name, date of birth, and insurance, because it's so common. But what if instead there is another person and a real voice on the other end of the phone call that sounded genuinely concerned about helping you solve your problem? When we begin this phone call, we want to know what's going on with you, how it's affecting you, and what you want to be able to accomplish by coming to a specialty physical therapy clinic like ours. We want to help you. And having this conversation gives us the opportunity to determine if we'll be a good fit to help you succeed and if we can work together with you to help you achieve your goals. All of this happens before we take any money from you or have you come into the office. The second step is our root cause inspection. Patients come to us looking for solutions to pain in nerves, joints, muscles, tissues, and many are caught up in wanting to know specifically what tissue is broken, what tissue is responsible for causing this pain, assuming that if we can just take care of that one tissue, all the pain and problem will go away. It's almost as if you can find that right area where the pain is and inject it with some kind of medicine, all the pain will go away. But we know repeatedly that it's not that simple, because those injections do exist. We have anti-inflammatories and pain-relieving injections that we can place right in on the tissue where the pain is coming from, and yet still not have the problem go away. The painful site and tissue breakdown are actually just a symptom. And that's why we call this the root cause inspection, because just getting to the underlying symptom or identifying the underlying tissue that is broken and painful is only one part of the journey in uncovering the root cause. Often it comes down to, when we do our thorough investigation or thorough evaluation, we want to know how you move, what muscles are weak, how your body compensates for that weakness, and how your body responds to hands-on treatment and specific exercises that we prescribe. And the reason is the tissue that is broken down and painful is broken down and painful for a reason. It didn't just happen unless there's some trauma or car accident. There are some cases where that's the event, but so often when we're talking about chronic pain or lingering pain, long-term pain, it's not that simple. And people who have tried regular physical therapy, tried pain pills, tried injections, even tried surgery, only to come back and still have the same issue, it's because the broken down site, the painful site was not the root cause, it was only a symptom. And so getting to know your body, how it functions, how it moves, what muscles are weak, what joints are stiff and tight, will help us to really uncover what the cause is and then prescribe a treatment plan that's going to be specific and tailored to you in order to prevent those long-term breakdowns. Often, this kind of investigation can take a few visits. It's not okay to assume that after 60 minutes with us, we're going to have everything figured out. Often we can, but not always. And sometimes this takes a few visits to really fully understand how your body is connected to your pain. This takes time to identify the root cause, but it also significantly strengthens our ability to prescribe successful hands-on treatment and exercises specific to helping you overcome your problem. Some examples of cases that we've seen and corrected is shoulder pain and difficulty sleeping because of a herniated disc in the neck. That was resolved with neck exercises, decompression, and dry needling after spending months in a regular physical therapy clinic doing shoulder exercises for rotator cuff. It's easy to think that because this patient had pain in the shoulder, that must be where the site of the injury is. But upon further investigation and relentless investigation, we found that it was actually coming from the neck. And once we started treating the neck appropriately, her shoulder pain went away. And she had spent months in a regular physical therapy office doing rotator cuff strengthening exercises and not getting any relief. Another one we had was a foot pain and difficulty walking from chronic plantar fasciitis that was resolved with hip and core strengthening exercises because this individual was getting excessive hip rotation from weak hips and core after spending hundreds of dollars on custom orthotics and quality shoes. She was told that her feet lacked support and strength. And so in order to combat this lack of support, they gave her orthotics. And the issue was, if we could find out why her hips were weak, what was the uncover the underlying root issue, address the hip weakness, and now her whole hip and leg tracks more productively to prevent the falling arches and falling, we call it internal rotation, excessive internal rotation and falling arches on the one side that was so painful chronically that arch supports weren't helping, foot massages weren't helping, and even foot exercises weren't helping. We had to identify it was coming from the hip. We had another patient with knee pain that was taken out of her daily walks with her girlfriends because of ankle tightness and glute weakness. That was resolved with a mobility program for her ankle and core strength for her hips after she had repeated injections and x-rays that showed severe osteoarthritis. We get a lot of patients who will say, I don't know why I'm here. The doctor referred me here because there's nothing you can do for me. I have arthritis. You can't treat arthritis. You can't cure arthritis. And while some of that's accurate, we can't reverse arthritis. We can't take away arthritis. We can significantly improve the arthritic breakdown and significantly reduce pain caused by arthritic flare-ups. Arthritis is not a destination. It's not a terminal disease that's going to lead to eventual death and decay. We're all on a route of accumulating arthritis. Everyone is going to experience arthritis. Just like we're going to get gray hair, no one's going to escape it, but it doesn't mean that there's nothing that can be done. And often, the rate at which arthritis is progressing is something that we can significantly limit and even curtail. Step 3 of our process is a personalized plan of care. This is a crucial step to helping people overcome pain so you can live free from painkillers and avoid surgery and injections. And this is where we give our prescription to help you get better and stay better naturally. You see, the regular physical therapy model is based on volume, seeing 3 to 4 patients an hour and making it nearly impossible to avoid giving common exercises with very little hands-on treatment. With a personalized plan of care, you understand why we're prescribing you exercises and choosing specific hands-on technique with feedback from you about what is working and what you're comfortable with. You can just imagine, if we've all been to the family care physician, if I'm having to see 5 to 6 patients an hour, in PT's world it's 3 to 4 patients an hour, and able to spend 10 to 15 minutes with you, what kind of care can I give you? How much attention to your specific case can I offer? It's not that the PT or the doc is bad or that they don't have the skills necessary. It's none of that. It's the model that's not arranged towards giving you, the patient, the time and attention necessary to uncover and identify the root cause and then specifically give you treatment that's unique to your case. Once we identify the root cause, once we understand what is causing the dysfunction, we can treat it. And it is a matter of time, not a matter of skills. With a personalized plan of care, you will understand why we're giving you what we're doing. And this will include an understanding of things that might get in the way of your success, such as your work schedule, vacations, financial considerations, and time constraints to best put together a plan for you. We love it when people will come in and say, hey, I'm trying to get ready for a wedding in 3 months so that I can walk down the aisle or dance with my daughter. Whatever the case is, when people have specific goals and even a deadline, it makes it very, very helpful for us to say, okay, then we might need to do 2 to 3 times a week instead of once a week to get you to that point. Or we may want to make sure that you understand how important it is that you do your exercises 2 or 3 times a day for 5 days a week instead of 2 to 3 times a week. There's variations to your program that need to exist based on the amount of time that we have. Step 4 is reevaluation, because along your plan of care, we do reevaluations. And what this does is it's a timeout. Hey, pause for a minute. Let's compare what we found at the beginning of treatment on our initial evaluation to what we're finding now. Is it different? Are we on the right path? Are we seeing the changes that we need to help you arrive at your goal? Out of this reevaluation, there's only 3 possible outcomes. Number 1 is we're all better. Everything's feeling good. My pain is significantly improved and very stable. I'm very comfortable with where it's at. I'm confident and comfortable doing my exercises at home on my own. And this means that you're ready to discharge to a home program. This doesn't mean that you're done doing your exercises. This doesn't mean that you're done with care. This does mean that you can continue at home as much as you can progress individually on your own through your exercises and mobility program, depending on what you needed. The second option is you're improving. We see progress. We're on the right track, but we're not quite there. This is important to recognize because what we do see is not everyone's pace of progress or pace of recovery is the same or predictable. We can sometimes get into a kind of a guesswork of a few weeks, maybe a few months of how long it's going to take to get you better, but everyone's a little bit different. Sometimes we have vacations in between there, or sickness, or maybe some work deadline that needed to put some care on pause. There's all kinds of reasons why sometimes care can be delayed or accelerated. And at this spot, we say, okay, we notice things are improving. We're getting improvements in motion. Strength is improving. Pain is being reduced. Sleeping better at night. Whatever the case is, we're seeing progress. We're just not quite where we want to be yet. And that just means, great, we just need a little bit more time. We're on the right track. We're progressing the way that we need to. We just need to move forward and get a little bit more time. And the last one is everything's the same. Now, often this can frustrate a lot of people because they feel like they put a lot of time and effort and money into getting better and they feel like they're the same. And so, again, this timeout is intended to say, okay, what are we noticing? Is pain persistent? We're not seeing any change. And this often means something is missing. We're not quite on the right track of where we want to, so we need to take a step back and say, is there something else that we need to investigate to better uncover what the underlying root cause? Do we need additional imaging? Do we need to send out, refer, or request a X-ray or an MRI? Maybe we need to consult with a different specific provider. Sometimes it means that we need to change the course of treatment, and it's probably going to take more time. But just because your pain hasn't changed doesn't mean we're not seeing progress. We go through all the measurements that we did in the first visit of strength, motion, a few clinical special tests, all to better identify what's going on. And sometimes folks will be like, oh, I'm still in the exact same pain. Nothing's changed. But we go through the evaluation. We see that movement is improved, strength is better, they're sleeping better, but they still have the same levels of pain. Okay, we accept that, but let's also recognize the fact that we are getting improvements. And let's make some different tweaks, some different changes to your program to maybe approach the pain reduction first and then work through movements and strength. Some cases can include multiple reevaluations depending on how long you've suffered from pain and how many places we need to treat to get it resolved. Everyone's path to recovery is not the same. Even though conditions may be diagnosed the same, or age may be the same, gender might be the same, not everyone is the same. And so we take everyone's individuality into account, and it might take more reevaluations to get you to your destination. The last and final step, step 5, is polishing. Our body's number one goal is to work as efficient as possible and adapt to demands we place on them. Too often these demands are a rigid routine of sitting sprinkled with sporadic exercise. These are your weekend warrior types. Sometimes we can go weeks, months, even years without physically challenging our bodies correctly to avoid breakdowns in movement and strength that can lead to pain or tissue breakdown. The best way to stay free from painkillers, injections, and surgery is to be strategic with your exercise and activity to include unique challenges to strength, endurance, balance, mobility, and power. Once you finish treatment, we will have a discussion to see if you are a candidate for our preferred fitness program designed to help you keep the improvements you made during treatment and to keep you that way in the future. Too often, because people are ending care, they end their activity or they end their exercises. And that's just not the recipe for long-term success, especially from long-term success in natural attempts at recovery or medicine. It's just like eating healthy. You can eat healthy and lose a bunch of weight and feel great. Doesn't mean that you can now return to the lifestyle that got you overweight. Movement is very similar. It's very, very common that people will think that, oh, I'm all better now. I can go back to the way I was doing things in the past. And it's just not fair to accept. Our bodies are too efficient. They're too good at what they do. We can't overcome biology. And so we have to stay disciplined and consistent with that effort. And sometimes people need more help, more accountability to stay that way. And that's totally fine. Nothing to be ashamed about that. That's why so many people, it's worth the investment in health to do so. And until you do get very comfortable in being able to maintain it on your own, we're here to help, and you should ask for that help because that's going to ultimately give you the best success possible. We have a few patients right now who are still doing what we call preferred fitness, coming in after their work schedule during our later early hours and doing exercises and doing the things. And every month we change those up to be able to address whether that's strength, endurance, balance, mobility, and power. So many people over the age of 65 think power exercises are not for them, and it couldn't be more false. They still need to work strength and power because it helps avoid falls, it helps brace from falls, any kind of sudden movement, sudden jarring. Any of those kind of moves are power moves. Power moves are necessary for strength and necessary for long-term health and sustainability. I hope this helps. I hope this helps to open your minds to what real physical therapy can do for you and how unique and different it is from regular or typical physical therapy, where you often see your provider for 10 to 15 minutes at a time with very little hands-on care and very little supervision. If you've ever left a physical therapy appointment wondering, I don't know why I went in today, I could have easily done these exercises at home, or I barely saw my PT, start questioning if you're in the right place. Find a place that's going to really dig deep into identifying the root cause of your condition and help explain and clarify to you what you need to do to get better. Have a great day. Preferred Physical Therapy and the guests on this show does not recommend, endorse, or make any representation about the efficacy, appropriateness, or suitability of any specific tests, products, procedures, treatments, services, opinions, healthcare providers, or other information that may be contained on or available through this content. Preferred Physical Therapy and the guests on the show are not responsible nor liable for any advice, course of treatment, diagnosis, or any other information, services, or products that you obtain through this audio recording. For specific information regarding your case, please consult a licensed professional in your area.